My name is Dr. Goski, and I'm a psychiatrist at Lenox Hill Hospital. And today I'm going to talk to you about insomnia. This is a topic that comes up a lot in my practice. Probably 8 out of 10 patients will ask me, do I have insomnia and what can I do about it? So what is insomnia? Insomnia is defined as trouble initiating or maintaining sleep, which is associated with daytime consequences, and is not attributable to environmental circumstances or inadequate opportunity of sleep. Occasional short-term insomnia affects between 30 to 50% of the population, and chronic insomnia, which is defined as poor sleep more than 3 times per week, persists and that persists over a period of 3 consecutive months, can affect 3 to 5% of the population. Older age groups, people with mental health or medical illnesses, having a higher prevalence of insomnia. And studies show that insomnia can lead to numerous adverse effects on functioning, health, and quality of life. For example, insomnia can lead to daytime tiredness and affect professional performance, increase the risk of occupational motor vehicle accidents, can cause the development of psychiatric disorders, especially mood disorders, and can increase the risk of relapse of alcoholism. And more recent investigations also suggest that chronic insomnia can be associated with an increase in the risk of cardiovascular disorders, cardiac disease, and hypertension. Insomnia, what can you do about it? Insomnia can be a primary problem, or it may be associated with other conditions. So the first step is to identify if there are any underlying causes for insomnia and address them. For example, if you have a medical condition that contributes to it, or you take certain medications that induce insomnia, if your sleep is affected by the fact that you have depression, then talk to your doctor about it. Other causes of insomnia are stress, life events, and habits that disrupt sleep. And treatment can involve improving your sleeping habits or improving your sleep hygiene, plus or cognitive behavior therapy for insomnia or CBTI, relaxation techniques, and meditation. Sleep medication can also be helpful. However, behavior modifications should be prioritized, as studies show that behavior modifications are long-term more effective than using medication alone. So there are a few things that you can do to improve your sleep hygiene. First, create a very relaxing bedtime routine. At least 30 minutes before you go to bed, allow yourself to have a wind-down period, have a warm bath, listen to some soothing music, enjoy some relaxing reading, things that will help you get into a state that you'll be able to fall asleep easily. Environmental factors are also very important. Keep your bedroom very quiet, dark, relaxing, with a comfortable temperature on the lower side. Use the bed only for sleep and sex. Don't spend time in bed doing work or browsing on the internet. Actually, remove all electronic devices as TV, computers, smartphones from your bedroom. If you're a clock watcher, if you anxiously watch the clock during the night and count the minutes until you fall asleep, hide the clock. Be consistent. Go to bed every night at the same time, wake up at the same time in the morning, even during the weekends. Don't go to bed unless you feel sleepy. If you don't fall asleep after 10-15 minutes, get out of bed and do something relaxing. Return to bed only when you feel sleepy again. Try to avoid large meals and limit the amount of liquids before bedtime, and limit the amount of stimulating drinks as caffeine or tea in the late afternoon or evenings. Decrease the amount of alcohol or stop completely. Alcohol, although it may be helpful to you to fall asleep faster, it actually shortens the length of the sleep, causing awakening in the middle of the night, and also prevents you to have deeper stages of sleep, which are absolutely necessary in order to have to feel well rested in the morning. Try to avoid naps during the day. Any nap you take during the day will affect the quality of sleep at night. Get some exercise. Being active during the day can help you fall asleep faster at night. However, avoid heavy exercising, especially cardio, just before bed. So I hope that all these tips will be helpful in order to improve your sleep hygiene. And now I'm going to introduce to you Dr. Ara Korhun. He's one of our clinical psychologists at Lenox Hill Hospital, and she will talk to you about the benefits of CBTI and other techniques on improving your sleep.
My name is Dr. Cecile Arak Orhun, and I'm one of the clinical psychologists at Lenox Hill Hospital, as Dr. Goskin has introduced me. Today, in addition to Dr. Goskin's discussion on sleep hygiene and medical aspects of sleep and insomnia, I will speak about how to monitor sleep-related behaviors and role of worry in sleeping difficulties. First, I will speak about monitoring sleep-related behaviors. It's important to monitor behaviors and thoughts that may contribute to sleep difficulties. While you are in the beginning of your journey of addressing these problems, it would be helpful to keep a notepad and pen next to your bed so that you can monitor easily. Important aspects of sleep to monitor include how many times do you nap during the day, how many times you doze off, and dozing off may include falling asleep in front of the TV where you notice you missed some parts of your show that you were watching, or dozing off in the bus and you missed your stop. Something else would be, what time did you go to bed? What time did you try to sleep after going to bed? And how long did it take you to fall asleep? And how many times did you wake up between the time you slept and your latest wake time? Something else would be, what time did you wake up and what time did you get out of bed after waking up? Did you take any medications, alcohol, and finally, how was the quality of your sleep? Monitoring these would give you an idea of where things might be going off, and you can also refer back to what Dr. Goskin discussed about using the bed only for sleep and sex and not spending too much time, and make your conclusions from there. When people are struggling with sleep, they may engage in certain behaviors to compensate for the lack of sleep, which in fact may worsen the problem. And these include going to bed early, sleeping in and therefore disrupting the regular scheduled sleep-wake cycle, and napping throughout the day to make up for the lost sleep, therefore causing reduced desire or inertia to sleep at night. Important factors to keep in mind in tackling insomnia is consistency and patience with new practices. Insomnia can have an impact on your thoughts, changing the way you think and also change how you view sleep. Where does worry come into play in this, you might ask? Although worry does not on itself solely responsible for insomnia, it can start insomnia episodes and also be an agent in maintaining chronic insomnia. With insomnia, your thinking style can feel as if there are several thoughts running through your head at the same time. It might be difficult to control the amount of worried thoughts you have in mind, especially after the effect of sleep difficulties may have on you. You tell yourself, where does worry come into play in all this? Although worry does not on itself solely responsible for insomnia, it can start in insomnia episodes and also be an agent in maintaining chronic insomnia. Your thinking style can feel as if there are several thoughts running through your head at the same time, and it might be difficult to control the amount of worried thoughts you have in your mind, especially about the effect of sleeping difficulties may have on you. Certain ways of thinking and thought processes can get in the way of being consistent with important sleep hygiene or monitoring that Dr. Goskin just discussed as well. It might feel as though one thought leads to another negative thought, which then might lead to another negative thought. You might liken this to mental overactivity, which may have a huge impact on how you think and feel about your sleep. Now, I will talk about two strategies to address this mental overactivity that may take over your mind right before sleep. One is leaving the room, and the other is constructive worry method. Some people notice that even when they don't tend to worry during the day, they notice themselves worrying as soon as they get into bed to relax and sleep. The bed becomes a cue or a signal for worrying. One important strategy to tackle this would be to get out of bed and go to another room once you notice yourself worrying. Once your mind calms, you can go back to bed. The key is to be patient and consistent in this practice, and you will notice that your mind will understand that bed is not the place to worry. You may say to yourself, But what if I get out of bed? I might lose any chance of sleeping altogether or awaken myself even more. And I would say quite the contrary, because if you continue to use your bed as a place of worrying and problem solving, it will just continue the cycle. The second strategy to manage anxieties before sleep is using constructive worry method. Constructive worry method is used when you are trying to relax to sleep and you start to notice troubling thoughts and worries taking over your mind. To do the constructive worry, you would choose an appropriate time, few hours before bedtime, and prepare two columns, one for concerns and another column for solutions. In the concerns column, write down your concerns and problems that especially keep you awake at night. In the next column, solutions column, write down how you would like to work on these concerns. Either solutions to your concerns or what might be some initial steps that needs to be taken to address these concerns. For example, you can decide to write down how to solve your problem, or that the problem is actually not worth necessarily stressing about, then you would write this. Or you might need to write that you realize that you need external help. After writing all this for all of your concerns, and once you are done, store what you wrote next to your bed. When you notice yourself worrying again, this would allow you to remember that you already dealt with the problem. Now I will talk about certain thoughts and beliefs that may worsen your sleeping difficulties. To outline, I will talk about the role of catastrophizing, misattribution, jumping into conclusions, self-fulfilling prophecy, and filtering out the positives, which are known as cognitive distortions and can have an impact on thoughts and beliefs and actually are quite workable. A process that may contribute to nighttime worries are the thoughts or beliefs that you may have about sleep and its impact on you. You may notice that you have a tendency to think mostly negative thoughts or consider only worst case scenarios when your mind is in this state. A few minutes ago, I discussed that one negative thought can lead to a chain of other negative thoughts. These thoughts may involve and centralize around sleep. You may notice that you start to stress out that if you don't get good sleep, something bad will happen, which then triggers even more catastrophic thoughts. For example, you may find yourself saying, if I don't get good sleep tonight, I will make mistakes during work tomorrow and then I will be fired. Or if I don't get good night's sleep tonight, I will be irritable, end up arguing with loved ones, and no one will want to be with me. It's important to realize that worrisome thoughts may feel as if they are facts, and it may feel as though they will very likely happen when in actuality, their likelihood is very low. As a result, when you notice you are worrying and making catastrophic predictions about the future, it is helpful to think about how likely something may actually happen and what's the evidence to suggest. For example, in this scenario of thinking about if you don't get good sleep tonight, you might make mistakes tomorrow and then you will be fired. Actually, most likely what will happen is you will need to put in a little bit more effort, but others probably won't notice it. For example, let's say Jack was struggling to fall asleep and he has an important work presentation tomorrow. Then he started to worry, thinking that he will be feeling very tired tomorrow and he will fail the work presentation. Then he starts to think that if he failed the work presentation, his team will be upset with him, and then he starts to believe that he will be fired. This just starts a cycle of anxiety, ruminations, and his mind goes on and on. If we look into this train of thought closely, we can notice that Jack is thinking in extremes and thinking of a catastrophic outcome. First of all, even if he was unable to fall asleep last night, that would not mean that he will actually fail the work presentation. He might actually have a boost of energy because his body is preparing him for the performance. And that would make him more alert by increasing his adrenaline levels. And even if he did not rest as much as he wished to, he will have the boost of energy necessary. Furthermore, his team or boss firing Jack as a result of one incident is quite unlikely. So this is where jumping into conclusions or catastrophic thinking really comes into play. This way of working on your thinking style, like we just did, can have significant benefits. Again, you can utilize a thought record to work on your thoughts by writing down your negative thoughts, the evidence for the negative thought to happen, and whatever evidence you can think of that would be contrary to your thought. And finally, write a statement that is more realistic or neutral way of looking at the situation. Another common thinking style that's associated with insomnia is misattribution. So thinking that any negative thought or mood you are experiencing throughout the day is a result of prior night's sleeping difficulty rather than other causes. Our attention and energy levels actually fluctuate throughout the day. And regardless of insomnia, it would fluctuate. So this way of thinking and attributing any thought, any low energy to insomnia actually might be unrelated, might stress someone unnecessarily, and can be worked through. Another way worrisome thoughts can have an effect is you may believe that having an anxious thought throughout the day means you will have an anxious episode right before bed. This would be jumping into conclusion. And you may have heard of self-fulfilling prophecy before, a false belief that you have might influence your behavior in such a way that actually it shapes the reality, making it happen. For example, assume that you did not have good night's sleep and you woke up convinced that you will have a bad day. And you start approaching any event or person throughout the day with that expectation that it will be a negative experience, to the point that you ensure that it happens. Because you had anxious thoughts during the day does not mean that you will have an anxious episode right before bed, and it can be helpful to use the constructive worry method here. People struggling with insomnia also may filter out any positive experiences during the day, focusing only on the negative experiences to, in some ways, to confirm that they had a negative day as a result of the insomnia, when most likely during the day they had a mix of positive, neutral, and negative experiences, because that's how most days are. Today, I tried to summarize some thinking styles that are common in people struggling with insomnia, which may be adding fuel to their struggles, and also some techniques that may be helpful. Another very useful tool that you can find podcasts and guided meditation on is progressive muscle relaxation, that sufferers of insomnia and anxiety find very helpful. There is a lot of help with use of technology, and there are several apps for iPhone and Android that also aid in sleep hygiene, monitoring, and relaxation that are very useful. Thank you for listening to us.